Good afternoon, good evening. It's 4 p.m. Thursday. Time for our 4 p.m. lecture class. Tomorrow is the first day in a new module. So please remember to log into module 155. If you log into 154, you will not see any assignments. Module 155 starts tomorrow. I have already opened day one, and you only are responsible for day one lab, which is because you're starting on a Friday, so that lab is due on Sunday. But once you log into 155, that day one assignment and lab is already open for you. This module starts tomorrow. Today is the last day in module 154. Also remember, you still have until Sunday to complete your exam, your final exam for module 154. So you still have until Sunday to complete that module 154 final exam and to make sure you finish all of your labs, your daily assignments. Everything is due Sunday. Even though you start in module 155, if you have labs that you have not completed, you still have until Sunday to complete those labs, but tomorrow starts module 155. So you'll have that one lab for module 155, but to complete your labs for module 154. So I'll be working in 2 modules. So just try to get everything done as soon as possible, but you have until Sunday. So today, let me share my screen. Today, we're going to go ahead and get started in chapter 24. Chapter 24 is a very interesting module. It doesn't want, I'm trying to let it. There we go. Very interesting module. And a lot of people think that it's just radiology, but it tells you right here, it says radiology is chapter 24. Sorry about that. Chapter 24 is radiology, and this is for module 155, which starts tomorrow. Radiology isn't just x-rays. A lot of people think of radiology as just getting x-rays done. It is not. Take a moment to scan the radiology section and read the subsection headings. You will see that ultrasound, guidance, mammography, home point studies, oncology, and nuclear medicine services are all reported using radiology codes. It is very interesting and varied sections. So in this module, you're going to the format, you're going to know, you definitely need to review your radiology terminology, terms, planes, guidelines, and we're not going to cover everything today, but those are the main things we're going to cover. Demonstrate an understanding of radiology terminology, very important, as in all of the other chapters. You have to know the terminology. The doctor is not going to write up those long words. He's going to be using abbreviations. So it's important that you understand the medical terminology. Analyze the elements of component coding and reporting radiology services. Identify elements of the global procedure. State the appropriate coding of contrast material. Explain the format of the radiology section. Demonstrate the ability to code radiology services and procedures. So once we go through a good bit of this information, next week we'll start with the coding in radiology. Next, it says the format. You know, it always starts in each chapter with that format. The format in radiology is the branch of medicine that uses radiant energy to diagnose and treat patients. The term originally referred to the use of X-rays to produce radiographs, but it's now commonly applied to all types of medical imaging. A physician who specializes in radiology is a radiologist. Radiologists can provide services to patients independent of or in conjunction with another physician of a different specialty. So that's important to know. Radiologists can provide services to patients independent of or in conjunction with another physician of a different specialty. The radiology section of the CPT manual is divided into subsections. The subsections are diagnostic radiology, that's diagnostic imaging, diagnostic ultrasound, radiologist guidance, breast mammography, bone joint studies, radiation oncology, and nuclear medicine. So the radiology section of the CPT manual is divided into subsections, and these are the subsections. Radiology terminology. The suffix graphy means making of a film. So remember, whenever you see graphy, graphy, that's making of a film, using a variety of methods. Radiography is a broad term used to indicate any number of methods used by radiologists to do diagnostic testing. The following exercise will familiarize you with some of the numerous radiographic procedures in the CPT manual. So that's one of your exercises, and it's just showing you all of the different terms. So when you see angiocardiography, that's heart and vessels. So you know cardio is heart, angio, vessels. Remember, graphy meaning including making of a film. So an angiocardiography is making a film, an x-ray of the heart and vessels. So anything with graphy at the end of it, you know that it's making a film. So it's doing an x-ray of. So that should help you when you're looking at and trying to break down the prefix, the suffix of a word. So it's good to make sure that you understand the medical radiology and all of medical terminology. Terms, they say here are just a few more radiographic terms for your review. So make sure you review when you all see MRI, magnetic resonance imaging. People just know it as an MRI. And then when the doctor is explaining or when he's writing in the medical record, he's not going to have on there magnetic resonance imaging. It's always MRI. And then it tells you what it is. It is a radiology technique that uses magnetism radio waves and a computer to produce images of body structures. The MRI scanner is a tube surrounded by a giant circular magnet. The patient is placed on a movable bed that is inserted into the magnet. So that's how MRIs are. So please make sure that you review these terms. That was an example that I just used for that MRI because you always hear somebody say, oh, I need to get an MRI or a CAT scan. So just becoming familiar with the medical terminology. Planes. Terminology referring to planes of the body and the positioning of the body is often used in the radiology section. A position is how the patient is placed during the X-ray examination, such as lying down or standing up. And a projection is the path of X-ray beam, the X-ray beam. An example of a projection is anterior-posterior, which denotes that the X-ray beam enters the patient's body at the front, which is anterior, and ends from the back, posterior. An example of a position is prone, which means the patient is lying on his or her anterior front, but the entrance and end of the X-ray beam are not specified. Familiarity with this terminology will aid you as you review the radiology section and begin to choose the correct codes for physician services. And so they show you the different illustrations. And then a lot of times, like if a female, if they're pregnant and they're going to take an X-ray, they put this block in front of you. It's like a thing to protect you from those rays from the X-ray. So this is a picture, a diagram of what happens when you're getting that anterior and posterior view. So just make sure that you're paying attention and looking at the terminology that's used with the different planes. Figure 24.2 shows proximal and distal body reference. Proximal and distal are directional body references. That means closest to the proximal or farthest from distal the trunk of the body. These terms are relative, meaning they are used to describe the position of the part as compared with another part. Therefore, the term proximal describes a part as being closer to the body trunk than another part, and the term distal describes a part as being furthest away from the body than another part. So just make sure you review the diagrams. And so they give you another example here. Figure 24-2, distal, proximal. Anterior, posterior projection, showing when you're laying on your back. Then they're showing you posterior, how you're laying flat down. Lateral positions or side positions. When the patient's right side is closest to the fume, it is called right lateral. When the patient's left side is closest to the fume, it is called left lateral. And they have, for example, let me go down, scroll down, 24-5 shows a left lateral position, and 24-6 shows a right lateral position. The use of these various positions allows the physician to view the body from a variety of angles. A and B shows posterior, anterior, and lateral positions used to view a patient's lung with emphysema. So you see how they're showing, this is the position 24-5 and 24, this is 24-5, and this is 24-6. Posterior, anterior, and lateral radiographs of the thorax in a patient with emphysema. So I'm gonna go back and let you see the top part, how they're doing it. With the arms up, the left and lateral projection, the right lateral projection. Dorsal more commonly refers to the back, but may be stated to mean supine, means lying on the back. Ventral more commonly refers to the anterior, but may be stated as prone, means lying on the stomach, and lateral means lying on the side. Decubitus positions are recumbent lying positions. The X-ray beam is placed horizontally. Ventral decubitus, which is prone, is the act of lying on the stomach. So just look at these different positions when they're doing X-rays. A, B, C, D, E. So look at the different positions that they're lying on their backs. All of the different positions that they're using to take the X-ray. Recumbent means lying down. So they're showing you different positions and angles on how the X-rays are taken. So make sure that you're paying attention to the diagrams to become familiar with the different positions, how X-rays are taken. When the patient is positioned on his or her back, dorsal decubitus, and the X-ray beam comes into the left side of the patient, the positioning is dorsal decubitus. But the view obtained is a right lateral because the right side is closest to the fume. So they're showing you right here, the left lateral decubitus, and then the right posterior oblique. So it's all of the different positions that they're showing you. So now I'm gonna switch over to the PowerPoint slides so you can become a little more familiar. So it's telling you here, radiology, branch of medicine that uses radiant energy to diagnose and treat patients. Specialist in radiology is a radiologist, doctor of medicine. Radiology subsections, diagnostic radiology, aorta and arteries, diagnostic ultrasound, radiologic guidance, breast mammography, bone joint studies, radiation oncology, nuclear medicine. Remember, I told you to make sure that you always read the gray section under the PowerPoint slides. When we look at the views of the slides, it says slide 3 indicates a subsection in the radiology section of the CPT manual. Diagnostic radiology subsection contains the most standard radiographic procedures. Next, we have terms. Fluoroscopy, views inside of body, projects onto television screen. Live images by which physician can view function and structure of organ. And they give you an example in that code range. 71047, 76000, chest x-ray with fluoroscopy. Magnetic resource imaging, with that we just reviewed, MRI. A lot of people, when they're saying they're going to get an MRI, but they don't really understand what that means. So an MRI is magnetic resonance imaging. MRI uses magnetic energy to view soft tissue structures. The example, when you look in your CPT manual, will be 72148, MRI of lumbar spine canal. And here's a picture. And this is also located in your book of what the MRI is taking a picture of in the image of it. Tomography or CT, just reviewed that about a CAT scan. Tomography used to view single plane of body. And they give you an example of where it is in the code range. Tomography or CT is the view of a single plane of the body attained by blurring out all other layers. The code for CT scans are found under the body area that is being scanned. So that was some views from the PowerPoint that you can review to help you better understand when you're looking at those planes. Remember, these are your daily assignment. You would have this in your daily assignment, exercise 24-2. Here are some more diagrams. Different projections when they're taking x-rays on how your body is placed when they need to take that x-ray. Remember, the guidelines are very important. You have to read those guidelines to make sure that you're coding correctly. As with all guidelines, the radiology guidelines should be read carefully before radiologic procedures or services are reported. The guidelines contain the unique instructions used within the section and the indications for multiple procedures, separate procedures, unlisted radiology procedure codes, and applicable modifiers. So that's why, remember, your modifiers are in the front cover of your CPT manual. So always reference that front cover. All of the CPT modifiers are there. Professional, these components are as follows. Professional describes the service of the physician, including the supervision of the taking of the x-ray film and the interpretation with report of the x-ray films. So this is going to be very important when you're doing radiology and coding for radiology services. You're going to have the professional, the technical, and the global components. Technical describes the service of the technologist, as well as the use of the equipment, film, and other supplies. So remember, the professional component describes the services the physician is performing. Technical components describes the service of the technologist, as well as the use of the equipment, film, and other supplies. And then you have the global component. The global describes the combination of the professional and technical components. So that global is going to describe the two, professional and technical. So when you look at those modifiers, make sure that if you're saying professional, the physician is included in providing the service. Technical, that's the technician and the equipment and supplies and the film. And global is a combination of the two, the professional and technical. Remember to always read your coding shots. It says for your coding shots, third-party payment is generally 40% for the professional component. Might want to highlight this because this is important. With third-party payers, it's generally 40% for the professional component, 60% for the technical component, and for the global services, it's 100%. So this, always read your coding shots. Third-party payment is generally 40% for the professional component, 60% for the technical component, and 100% for the global service. When only the professional component of the service is provided, modifier 26. So in your CPT manual, if you look at modifier 26, that's when the professional component of the service is provided. It's placed after the CPT code. So that modifier is placed after the professional component code, after that modifier. When only the professional component of the service is provided, modifier 26 is placed after the CPT code. Modifier 26 alerts that the third-party payer to the fact that only the professional component was provided. So here's an example. An independent radiology facility takes a chest x-ray with 4 views, which is code 71048, and sends the x-ray to an independent radiologist who needs the x-ray and writes a report of the findings in the x-rays. The coding for the independent radiology would be the professional component only. So they're showing you an example. 71048 with modifier 26. Complete checks x-ray 4 views. There is no CPT modifier to indicate the technical component of radiologic service. The modifier most commonly used is the HCPCS level 2 modifiers. And then you would always put on there, that's TC. TC, the technical component, which reports the technical component. When submitting claims, the radiologic services in which only the technical component was provided use a code followed by TC. For example, if you were the coder for the independent radiology facility that took the chest x-ray 71048 but sent it elsewhere to be interpreted, you would report the technical component only if you sent that out, but you were that technologist who did the actual report. Coding shot. So in radiology procedure, you're going to have a lot of coding shots. Make sure you pay attention to those coding shots. TC, technical component, and modifier 26, professional component, are terms used by third-party payers. When contacting a payer regarding payment of a service, first determine if there is a separate allowance for the technical component and modifier 26. Supervision and interpretation imaging guidance. So if you're going to be working in a clinic and you're, working with that hospital and, the x-ray and radiology department, these are the things that you will be billing. Technical component, professional component. These are the different things that you would be using with those modifiers to send out to third-party payers. Supervision and interpretation, imaging guidance. The other coding practice most commonly used in the radiology section is called component coding, which means that a code from the radiology section as well as a code from one of the other sections must be reported to fully describe the procedure. So I'm going to go over that again because that's very important to understand. The other coding practice most commonly used in the radiology section is called component coding, which means that a code from the radiology section as well as a code from one of the other sections must be reported to fully describe the procedure. For example, Interventional radiologists may inject contrast material, place stents, catheters, or guide wires, or perform any number of procedures found throughout the CPT manual. Many times before radiology procedures can be performed, a contrast material must be injected into the patient to make certain organs or vessels stand out more clearly on the radiographic image. When this contrast material is injected into the patient by the radiologist, a CPT code from the surgery section must be used to indicate the injection procedure, and a HCPCS level 2 code is reported for the contrast substance, such as A4641. I don't know if you all, Jared, were you here for HCPCS? Okay, so you will be covering that. You didn't get HCPCS yet. So you'll be coming around to that as well. Coding shot. Codes in the radiology section describes only the radiology procedures, not the injections or placements of other material necessary to perform the procedure. Codes in the radiology section describes only the radiology procedures, not the injections or placements of other materials necessary to perform the procedure. You have this as an assignment. And then on here we have odds and ends. Many of the code description states radiologic supervision and interpretation, and alert you to component coding, letting you know that modifier 26 or TC may be appropriate. Always read the parenthetic information that follows the component codes. So when you're looking at your CPT manual, always read what's in parentheses. Don't just code, read what's in parentheses, and it will inform you if more is needed, if you needed to add more. It says, the rules per NCCI CPT codes, this range, 70,000 through 79,999. Some studies may be performed without contrast, with contrast, or both with and without contrast. There are separate codes to describe all of these combinations of contrast usage. When studies require contrast, the number of radiographs obtained varies between patients. All radiographs necessary to complete a study are included in the CPT code descriptions. So it's very important to make sure you read those descriptions. Codes are also often divided on the basis of whether contrast material was or was not used. The phrase with contrast in the CPT manual means contrast that was administered intravenously, intra-articularly, or intra-arthically into the subarachnoid space. So that's inside of the muscle, going through the vein. If the procedure indicates that contrast was administered orally or rectally, the service is reported as without contrast. So if it was oral through the mouth or rectally through the anus, then it's reported without contrast. And your coding shot, report the supply of contrast material with medicine section. So see, this is detailed. So this here, if you're working in the radiology section, majority of this information is going to be already in the system, because they would know what they use, what materials they use, and all of this would be in their system. So don't become alarmed and saying, oh my goodness, this is just too much. And the radiology specialists in that clinic, when they're just doing x-rays, everything is already there because they only do specific and specialized services. So when you go in at MRI for MRI, all of that's going to already be in the system for you to understand. And then you just have to read the medical record to see what else is needed. But most of
I got a question.
Yes.
Okay. So I've noticed where my location is at, they actually have an x-ray technician that they're hiring for.
Mm-hmm.
would that be considered what we're studying about right now, or?
So you wouldn't qualify for x-ray technician, but you would be able to do the billing for that service. Because
Okay.
you're not training to read x-rays, but you're getting the understanding of what goes through it, the process, knowing the planes, because when that's written in the medical record, you have to understand what is being said in order to build the correct codes.
Gotcha. Okay.
Coding shot. Report the supply of contrast material with medicine section code 99070. Supplies or a HCPCS code. The injection of the contrast material is included in the with contrast radiology procedure code, unless guidelines state that a surgical code should also be listed to report the injection procedure. Avoid, listen to what it says here, avoid reporting 99070 if there is a more definite HCPCS code available. And when you're looking at those codes, it's going to give you that information. Need this or need that, add this. So if you're looking and you're reading and not just picking that code, when you see what it says, you'll be okay with knowing what to code.
That's kind of what I do, is I go through and I just skim through. And I notice, like, when it says something about, don't code with this code or don't code with that code, that's kind of where I get my answers.
Right. And they usually tell you, that's why it's so important to read your guidelines.
Yeah.
And everything that's in parentheses. So it says here, there are new guidelines issued by CMS that were originally titled Medically Unbelievable Edits, which is MUEs. CMS changed the name to Medically Unlikely Edits. So look at that. That might be one of your true false. There are new guidelines issued by CMS that were originally titled Medically Unbelievable Edits. What is that? MUEs. CMS changed the name to Medically Unlikely Edits. So you see that little difference? Unbelievable to unlikely edits. This information is included in a software system that allows Medicare to reduce the number of claims that contain medically improbable information, such as a hysterectomy on a male patient. There are approximately 3,000 edits in the software, and 60 of those directly relate to radiology services. One type of edit is the maximum number of units that can be reported. So make sure you read into that, because there have been changes in the CMS guidelines.
Try telling my fiance that, he don't believe me.
Yes, a lot of changes. An interventional radiologist is a physician who is skilled in both the surgical procedure and the radiology portion of an interventional radiologic service. The interventional radiologist is a board-certified physician who specializes in minimally invasive treatments, entry into the body for diagnostic procedures, performed using image guidance. These procedures have less risk, pain, and recovery time compared with open surgery. For example, an interventional radiologist who perform a liver biopsy using CT guidance to locate the lesion will report the service with a surgery code, which is 47,000, and a radiology code 77012 through 26. The interventional radiologist provided the surgical portion of the service, reported with a surgery code, and provided the professional portion of the CT guidance service, reported with a code from the radiology section with modifier 26. So with this, you're going to be seeing, you're going to be using professional, technical, or global. So make sure that you're reading those guidelines to understand which service. So what did I say? What was professional component? Professional component is when what? Hello.
What you say? I'm sorry.
What is professional component is when what happens?
Um,
It's with the physician.
Correct. Professional component is when the physician performs the service. And what is technical component?
when the technician does it,
Along
like
with what?
along with with the physician.
Now, okay, technical component is what does he use? So a technical component, you would use the technologists along with the supplies, film,
And the equipment.
yeah, and the equipment. Correct. And then what is the global?
With all of it.
Right. So global is when you use both professional and technical. So what are the percentages? What is the percentage for professional?
40,
Technical
60
and global.
is 100.
Correct. So you already know that's on your exam, right? On that day one. So make sure you remember that. Yes. And we're going to stop at diagnostic radiology. We're going to cover it. The most standard, so listen to this, the most standard radiographic procedures are contained in the diagnostic radiology subsection 70010 through 76499 of the radiology section. This subsection describes diagnostic imaging, including plain X-ray films, the use of computed axial tomography, CAT, CAT, or CT scanning, magnetic resonance imaging, MRI, magnetic resonance angiography, MRA, and angiography, CT scanning, using an X-ray beam that rotates around the patient, as illustrated. So I'm going to go down so you can see the diagram there. Shows a detail that can be obtained with MRI and CT scans. Special computer software is used with CT scanners to produce three-dimensional images that enable the study of internal structures. Tomography, CT scanning, and MRI may include the use of injectable dyes, radiographic contrast to aid in imaging, and the codes are divided on the basis of whether or not contrast was used. For example, under the subheading spine and pelvis, the codes for CAT, MRI, and MRA are divided as follows. C2192 computerized tomography pelvis without contrast material. 95 magnetic resonance example, proton imaging pelvis without contrast material. 98 magnetic resonance angiography pelvis with or without contrast material. So it's just saying that's what you have to make sure when you're reading the code, that you see if it's with or without. And it's showing you here axial MRI frame, arrows highlight the descending aorta. Note, one of these codes is for a CAT scan, one code for the MRI, and one code for the MRA. The codes are divided by CAT, MRI, and MRA throughout the diagnostic radiology subsection. So you must read carefully to ensure that you report the correct type of imaging. So you don't want to be reporting and it was a CAT scan when it was supposed to be an MRI image. So you have to pay attention to which one that you're reporting. And make sure that you're looking at those diagrams. So I'm going to go back again to they're not on here, to those slides, but make sure that you're looking at the slides right here and they're telling you the different types, but you have to be careful. If it's MRI, make sure it's an MRI. A lot of people get MRI and CAT scans confused. So make sure that you're coding and you're reading those guidelines to ensure that you have the best, you're making sure that you code accurately. That's what's in that patient record. Any questions or concerns? You definitely have to read through this. You definitely have to become familiar with that medical terminology. Let me stop sharing. You definitely need to know and read. And so this is going to be, this is being recorded, but remember, tomorrow is the first day of module 155. So you definitely need to read these PowerPoint slides. You need to make sure you're understanding the medical terminology. Next week, you'll be having your exam. I think it's day 5 or 6, you'll be having the first part of this exam. So please become familiar with the medical terminology. Make sure you know the difference. Like I gave you that example because I know that's on the exam. With the unbelievable and the unidentified, that is on there. So make sure you're reviewing. So any other questions? Remember, finish up your labs, exams, daily assignments. You have until Sunday to complete those assignments. But module 155, please log into module 155 on tomorrow. I have already opened day 1 for module 155 and the day 1 lab that's due on Sunday. So if you want to hit, I'm sorry.
I'm sorry. The PowerPoints on when in 155.
Yeah, they're there. I just have to open the PowerPoint slides.
Oh, okay, all right.
Yeah, I opened the assignments, but I
But
haven't opened I have to open the slides for you.
Okay,
So just, yeah, I'll be doing it as soon as we log off.
Okay.
So you'll be able to get in and get started. But remember, please try to finish those labs in 154. Please try to finish your exam. Everything for 154 is due Sunday by 11:55 p.m. Your day 1 for module 155 is due Friday by 11:55 p.m. And your day 1 lab is due Sunday by 11:55 p.m. So try to make sure that you all complete all of those assignments. If you have any questions or concerns, please do not hesitate to reach out to me by Friday.
Except for on the weekends.
I was about to say it. By Friday. My office hours are 8 to 4 on Friday. You can email me. Please do not contact me in reference to labs, exams, or daily assignments on Saturday or Sunday. You can email and I will respond to you on Monday. I will not respond to any assignments, questions, unless it's an emergency, but assignments are not emergencies because those can easily be reopened. So that's not an emergency. If you're saying you forgot to do a lab, you do not have to contact me to tell me that on Monday, or you can email it and on Monday, I'll reopen the assignment. Is that simple?
I almost texted you the other night because my laptop was going on the skits. I was in the middle of taking my exam and it like completely shut down on me like 3 times.
Were you able to complete it?
Yeah. Finally.
Okay.
After it decided it was going to be Better Betty.
Yes. So remember, try to complete, but anything in regards to assignments, labs, exams can wait till Monday. So you all have a fabulous weekend. Oh, I'm sorry. One thing, Jared, can you please explain and say how fast and the process that you went through for the MJ Foster grant?
Yeah, I got the email from you, and then I ended up getting the email from the lady Bridget in the financial aid office. She sent me the step-by-step what I had to do, and in the email that she sends out, it's like this part you do this part you do that, this part it was like broke down like that. I submitted it Saturday while I was at work, and yesterday I signed the paperwork on it and I got approved from the grant. It was that fast. It was like a couple of days.
So listen to that. So that MJ Foster grant, if you are interested in getting a refund or getting some assistance, you have to find out if you're eligible. Only thing they can say is yes or no. And within a few days, Jared was approved. So please, when we're sending out information, please make sure that you follow up on it. The financial aid officer will send you the steps, the guidelines, and they will get back in contact with you. And that was blessed because Saturday was they were off. So basically within 3 to 4 days, they responded and he was approved within 3 to 4 days. It's that simple and easy. So please, you can wind up getting money back. They'll assist you with paying your tuition. So please respond. Take advantage of that MJ Foster grant. It is very, very helpful.
So will
So-
we have to email the financial aid advisor? Or who do we have to contact about that?
Yeah, the financial aid advisor.
Okay. Could you send me Miss Bridget's email?
You
I
had
don't have her email address.
who did you have? Bridget Perry on?
Yes, ma'am.
Okay, I'll send it to you.
Okay, thank you.
You're
I
welcome.
had to go through my emails and figure out who I had.
Yeah, so if you find out who your financial aid officer is, send me that person's name and I'll send you their email address and you can contact them. And I'll put on there for the MJ Foster grant information.
Okay.
Any other questions or concerns?
Is it Friday yet?
Almost. So you all, without any further ado, have a great weekend. Please do not forget, do not log into 154 saying you don't have any assignments because we don't. You're starting in 155 tomorrow, day 1. So please log in to module 155. Complete 154. It will be open through Sunday. After that, it will be closed. And you will not be able to get back in module 154. Log into 155. I will be opening your PowerPoint slides as soon as we get off and I convert everything. I will be opening everything else up. So you all have a wonderful and safe weekend, and I will see you all on Tuesday. Enjoy your weekend. Bye-bye.